Hi guys, welcome to my Chart Smarter, Not Longer series where I go over a couple of tips for clinicians just to help you not just survive during charting, but to thrive. Because as clinicians, whether you're a nurse practitioner, physician assistant, a therapist, or a doctor, we all just need tips. The days can be long, but why make them short? Why make them even longer? Let's make them shorter. So let's go over this first one, document in the room. So when I do consult with a lot of clinicians, when I do meet with them to go over their charting, they can't really remember what happened with the patient. So they're like, I'm not too sure. But the goal is to make sure that when you're done for the day, to allow yourself the time to, okay, oh, I remember this patient. This is what happened with this is what happened here. This is what I scheduled as a treatment, follow-up plan, yada, yada, yada. So it's easier to chart as you talk, and you'll remember more details and avoid after hours backlog. Because one of the things that I hate when I first started was when I finished the day and for the life of me, I could not remember who was who. It was one of the most frustrating things where I had to go and remind myself, okay, what time was it? Oh, is this the one that had a cat and a dog and the mom was in the hospital? Because guess what? When you're in the clinic seeing a patient in the room of visit, whether it be in the home or acute care, there's a whole lot of fluff that you have to kind of cipher through in order to chart. But just imagine when you're inside of the room, you already are talking to them, they're telling you about their issues, you're charting as you're talking. And not to be rude while you're charting, because there's some people that just, those people that just type, they don't even look. They walk in, they don't even look at the patient. But for me, it's kind of like this skill where you have to, you talk and then you're also charting. Because at the end of the day, I want you to go home. I want to go home too. So just make sure you're documenting in the room. It just makes it so much easier. And if you want a little bit of extra tips, I will down below have a link to my book, Chart Like Your License Depends on It, where it goes over the top tips just to protect your revenue and save time as a clinician. All right. Message me if you have any questions, and thanks for watching. Bye.